Thank you, Mr. Speaker. I yield 2.5 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Louisiana, Dr. Boustany.
The gentleman from Louisiana is recognized for 2.5 minutes.
Thank you, Mr. Speaker, and I thank Chairman Camp for his leadership on this issue. I rise in support of this bill. And let's be clear, successful health care reform efforts must begin by lowering cost, promoting high-quality health care, and fostering innovation. Obamacare does the opposite. Even Medicare's own actuary warns that the President's medical device tax will increase Americans' monthly premiums. The tax will also eliminate more than 40,000 jobs. Passage of this bill will reduce costs and save jobs by repealing this tax. Now, Mr. Speaker, as a heart surgeon, I have used medical innovation that have saved thousands of lives, and I want to highlight something. Back in the 1950s, when we had no surgical treatments for heart disease, a surgeon watched a woman die helplessly. And after 8 or 9 months, he actually devised the very first heart-lung machine in his shop. And this led to an explosion in technology that has saved millions of lives the world over. This was an American innovation. Now, 80% of device companies today, 80% have less than 50 employees. These are innovators. These are the people who create jobs. These are the guarantors of American innovation. And without this, what are we going to have with our health care system? That's what's made American health care the best on the planet. We don't want to take a step back. Putting this tax in place will discourage these startup innovators. They will not take risk, and will harm patients in the long run because of the lack of breakthroughs. I'm also very pleased that this bill contains Ms. Jenkins's provision that will prevent a middle-class tax hike, will allow individuals to use their flexible spending arrangements to purchase over-the-counter medications without having to go see a doctor for a prescription, which is costly and time-consuming. And finally, I'm pleased that the bill includes bipartisan legislation that I authored with Congressman John Larson of Connecticut to make it easier for Americans to save their pre-tax dollars in FSAs without losing the money if they don't use it at the end of the year. It's their money. They should be able to keep the money, for God's sake, and use it for their own health care purposes or for whatever purposes they deem essential for their families. Americans need tax relief to help them with the rising out-of-pocket health care and other costs that they have. We should be encouraging and not punishing new medical breakthroughs. And I urge my colleagues to support these common-sense solutions in H.R. 436. Thank you, Mr. Speaker. I yield back.
Gentleman from Michigan, Mr. Levin.